Good morning everyone. I am Ms. P.Mythili, Assistant Professor, Department of Nutrition Dietetics, KSR College of Arts and Science for Women. Today we learn about the nutritional assessment and diet counseling in clinical setting. In this lesson, today we learn about what is dietary assessment and diet counseling by the dietitian. So we already learned about the clinical assessment and biochemical assessment, as well as today we see about the dietary assessment used to assess the individual or group persons of dietary habit to identify the dietary pattern, nutritional deficiencies and excess, and are useful in clinical and community and research setting. So there are the different types of dietary assessment are there. And then I list out the some of the types of assessment: 24-hour dietary recall method, food frequency questionnaire, weighed food inventory method, food record or food diaries, food composition table and nutrient estimation, rabbit assessment method for dietary intake, manual and software based nutrient analysis. So these are the some of the basic dietary assessment tools. On that we learn about the first 24-hour dietary recall method. As the name indicates, the dietary recall methods are taken by the 24 hours before the previous day. That is a simple and quick, inexpensive method to assess the person's nutrition intake and calculate the body mass index. And same well as food frequency questionnaire is used to assess the specific foods are consumed over a given period of time, such as week or month or yearly. It is useful for studying long-term dietary patterns and identifying commonly consumed food. However, it may not provide precise information about portion size and nutrient intake. So it is the food frequency questionnaire. It is the simple and the easiest method. In the dietary method, the 24-hour dietary recall and the food frequency questionnaire both are the easiest tools to assess the person's condition. Next, we see about the food inventory and food diaries. So in this method, the weighing foods before consumption to be recorded as well as the after consumption to be recorded. We just compare the before and after consumption of the persons, how much they intake are calculated by the person's consumptions. So the food as well as the food diary require individual to record all food and beverages consumed over several days. So the food inventory and food diaries both are detailed dietary information but can be consuming and may influence normal eating behavior. So nextly we see about the rabbit assessment methods, nutrient adequacy and limitation. In this assessment, based on the findings, dietary modification such as increasing fruit, vegetable, whole grain and protein rich foods can improve nutrient adequacy. So dietary assessment methods are used to plan nutritional planning and diet counseling. So limitations also there, such as recall bias, inaccurate portion size estimation and day-to-day variations in food intake. Therefore, selecting an appropriate method depends on the purpose of assessment and available resources. So as we know, there are so many types of dietitians. There are different types of dietitians who are allocated to this specific area. For example, clinical dietitians are work in hospitals and healthcare setting, and the community dietitians focus on public health and nutrition program to enhance their public nutritional status, and food service dietitians to manage the food production and quality in institutions and other relevant areas. So, and consultant dietitians provide private nutrition counseling and research. And the academic dietitians are involved in teaching and scientific studies. So these are the different types of dietitians are there, and the code of ethics for dietitians are some of the basic principles to be followed by the dietitian. They should be mainly provide evidence-based nutrition advice, respect cultural and individual difference, practice with honesty and integrity, and continuously update their professional knowledge based on the area of specific dietitian. And move to the responsibilities of a dietitian. The dietitians have here so many primary and secondary responsibilities, especially nutritional status, planning and prescribing diets based on the nutritional counseling, monitoring patient progress, conducting nutrition education program and collaborating with the healthcare professionals. So also, dietitian promote healthy eating habits and prevent nutrition related diseases. Next, we move to the topic diet counseling. So diet counseling is a process of guiding individual to adopt the health eating habits and make appropriate diet choice. So diet counseling may be delivered by the patient based on the health condition and nutritional requirement status. So there are the practical considerations in giving dietary advice. So every dietitian, we must note about the individual's age, health status, cultural background, economic condition, food preference, lifestyle and nutritional requirements. So these are the basic needs to assess the nutritional status and helping to implement the nutritional requirements based on this condition. Also, our advice should be the realistic, practical, and tailored on the person's need to ensure better acceptance and adherence. So there are some of the teaching aids and preparation of education materials also be there. First of all, we use it to explain the patients by the charts, posters, leaflets, pamphlets, flip charts, models, and audio-visual presentations. So many types are there, but we choose how they get to easily understand by our communications. So those materials we just choose based on their communication levels and their qualification. We use it to teaching the person's healthcare condition. So we choosing education materials should be simple, attractive, accurate, and disease specific. And more important, our choosing material aid should be they are easily to understand. The materials can also be prepared for patients with digestive disorder, hypertension, diabetes, obesity, and health conditions to improve understanding and dietary compliance. So not only these are the types, we also other types include CVD, CKD, hypertension. So these are these cases also have the specific type of charts, posters, leaflets, pamphlets are be used to explain the conditions of to the patients. So now we move to the conclusion session. So today we learn about the what are the dietary assessment used to assess the nutritional status of the patient, and how the dietitians are advised to the patient by the method of diet counseling. What are the materials or teaching aids to be used to treat the patient's diet counseling. So a dietary survey method are evaluate food intake, identify nutritional deficiency, and assess the nutrient adequacy to guide the individual's healthier food, move to the healthier food choice and lifestyle modifications, as well as dietitian play a vital role in nutritional assessment, education, counseling, and disease management. By applying a professional ethics, utilizing computer technology, and employing effective handling aids. So together, this contribute to nutritional status, disease prevention, better patient outcomes, and enhanced quality of life. So thank you.